I am Dr. Hari Prasad, consultant nephrologist and transplant physician at Kauvery Hospitals, Electronic City, Bangalore. In the Department of Nephrology, we see kidney-related ailments which include acute kidney disease and the chronic kidney disease. Acute kidney disease is a condition which affects the kidney in a short term, that is from days to weeks, whereas the chronic kidney disease is mostly an irreversible kind of a condition which affects the kidney for a period of from months to years. The most common cause of chronic kidney disease in India and throughout the world is the diabetes mellitus, followed by hypertension, followed by glomerulonephritis and other drug-induced kidney diseases. Common symptoms of the kidney diseases include swelling of the legs, swelling around the eyes, breathing difficulty while doing exertion like walking or climbing stairs, or rise in the blood pressures, abnormal urine quantity, that is reduced urine, or abnormality in the frequency of urination, that is passing the urine more number of times, or frequently getting up in the night, that what we call as a nocturia, or abnormal quality of the urine, which includes change in the color or presence of froth, that is foamy urine. As a kidney doctor, mostly I get asked about how do we protect our kidneys. Most importantly, it is the diabetes as well as hypertension that affects your kidneys on a long run. So it is first and foremost is, if you are a diabetic, control your sugars and keep your HbA1c at around 6. And if you are hypertensive, control your blood pressure, take your medications regularly and keep your blood pressure close to 120/80. Third is to take a good amount of water, that is between 2 to 3 liters of water intake per day, not too much, not too less of water. Fourth is control your salt intake, reduce the junk food as well as the packaged foods which are high in salt content, and don't add any salt into your food after cooking. Fifth is regular exercise and a good and healthy lifestyle. Sixth is controlling your body weight and keeping a BMI at around or less than 24 for Indian people. Seventh is to not to take over-the-counter medications, especially the painkillers. If you are a kidney patient and if you are having a pain or fever, the medications which are allowed are paracetamol, a tramadol, or an Ultracet. Coming to the management and treatment of the kidney diseases. If it is an acute kidney disease, maybe the patient has to be treated accordingly depending upon the cause. If it is because of the drug-induced acute renal failure, remove the drug, which is a causative agent, and support the kidney with hydration and maybe if required dialysis. If it is because of glomerulonephritis, the patient may require a renal biopsy to ascertain what kind of a glomerulonephritis is this and treat accordingly. In acute kidney disease also, the patient may require dialysis for a temporary purpose until the kidney recovers on its own. For the chronic kidney disease, initially the patients are managed medically, that is control of blood pressure, control of sugars, as well as controlling of proteinuria with certain medications that are used specifically in kidney patients. In advanced stages of renal failure, patients may require a renal supportive treatment, that is a dialysis or renal transplantation. The dialysis is of two types. One is hemodialysis, that is a blood-based dialysis. Second is peritoneal dialysis, which is more of a home-based dialysis. Typically in hemodialysis, patients need to come to a hospital anywhere ranging between 2 to 4 times a week, and each session may last around 4 hours. In this hemodialysis, the patient will be connected to a hemodialysis machine which will draw the blood from the patient, and the blood is purified inside the dialyzer, and the purified blood is returned back to the patient. And this during the dialysis, the uremic toxins as well as the excess of water is removed, and this period typically lasts for 4 hours.